so I began to worry about what is going to happen. I'm going to be stuck with emergency because I was having a lot of trouble up front with my teeth, and I was afraid they're going to just split and break. So a dry mouth. I feel my muscles are so tight. My ears were bothering me terribly. The back of my neck was bothering me terribly. I would get the pains, which you touch a couple of hairs on your head and it sets off extreme headaches, muscles. And then I would get the whole muscle structure. You could feel the muscle tightening up inside the head. I had the dry mouth, the dry eyes, the sinuses, the ears. Did I mention the ears? The pain in the ears, which was a tremendous amount of pain.
We have neck pain, we have shoulder pain, we've got jaw pain, jaw clicking, joint noises, facial pain, ear pain.
I have gone through periods of where I would wake up and I had been grinding overnight or clenching, and that clenching has been so extreme that I could feel from a point, upper and lower, numbness in my face. I've also felt, besides lines of numbness, in different areas, I have felt a generalized numbness, but I know that grinding my teeth has produced that numbness.
Hi, I'm Dr. Bob Logan, and I'd like to briefly review Sue Ellen's diagnostics and how we use them to help in her diagnosis and in determining what her treatment options might be. Sue Ellen's chief complaints were a long history of grinding and clenching her teeth, pain, clicking, and popping in her joints, a long history of bad neck and head pain when waking in the morning, very frequent headaches, mainly from the back of the neck, base of the skull, up through the temporal area, pain and ringing in her left ear, and significant pain, tension, and tightness through her cervical area, neck area on the left side, down through her trapezius muscles and back. She also complained of limited ability to fully open her mouth, jaw pain, and occasional locking. We use the K7 jaw tracking device to very accurately trace what happens when Sue Ellen opens and closes her mouth. A normal opening with a healthy disc position and happy muscles is straight up and down, approximately 45 millimeters wide. While Sue Ellen was opening, she shifted 2.5 millimeters to her left as she was opening, and then as she was closing, she slipped back over to the right about 3 millimeters before coming fully closed. Her full opening was only 36 millimeters, and her lateral motions, her ability to go left and right with the jaw, was very constrained, 5.5 millimeters, where it should be approximately 10 to 12. All this is related to the fact that her discs were displacing out of alignment as she was fully bringing her teeth together. In other words, as she was closing her lower jaw together, she had to pull her jaw back further than it should be in order to get her teeth to mesh together. This in turn caused her discs to displace, what we call an anterior disc displacement. At full closing, her joints were not properly centered. Her EMG readings, which are a measure of muscle activity, hyperactivity, and fatigue, showed that because she was having to retrude her lower jaw to get her teeth together, there was an increase in chronic tension in these muscles of about 300 to 400%. Since these muscles are interrelated to the muscles that go down through the back of the neck and the base of her skull, this would account for some of the headache activity she was experiencing. Her left masseter muscle was experiencing a degree of fatigue due to the fact that her jaw was overclosed. She was not balanced left side, right side, and the muscles were not supported at a proper resting length. Sue Ellen's ICAT, which is a digital cone beam CT scan that shows the relationship of the joints in 3 dimensions, revealed that her lower jaw was in fact retruded and her temporomandibular joint was compressed, which did not allow for proper disc placement. Using an ultra-low frequency TENS device, which gently pulses the muscles that are responsible for the posturing of the lower jaw, we are able to relax the muscles and allow the joint to decompress. This allows us to recapture the disc to optimal position, which then allows the body to show us where the lower jaw would optimally be positioned. We then take a bite at this relationship, at this relaxed, decompressed position, to help determine where Sue Ellen's teeth would come together if her entire system was relaxed. Sue Ellen chose a neuromuscular rejuvenation, which achieves an intricate balance between the joint position, muscle relation, and optimal tooth and arch positioning. This is the ultimate integration of form, function, and aesthetics.
Initially, when the work was done and those muscles let loose, that was just the most marvelous thing to me. The ears, the muscle pain, the whole dryness. I think a lot of things which science attributes to certain syndromal conditions, I have found have been relieved by having my teeth balanced. Few people knew what was happening. When one of those people first saw me the day after the work was done, and I was walking towards them across the parking lot, she hadn't seen my teeth, but she immediately knew that something was done, because my whole, what would I call it, my stance? She said I was opened up. Where she says I would normally look down and pull back. She said that I was opened up. It was a totally different look of confidence, openness, alertness, and so she could see that whatever had happened inside my mouth outwardly reflected to how I carried my body and presented myself. That is a very big aspect of the work that was done that is subsequent, but a very big part of fixing the structure of my teeth. It has everything to how I carry my head and carry myself.
So it makes a little
Very
difference.
Positive, not a little difference. It makes a great difference. I couldn't believe that this major work would have been done in so few visits, in so little time. But no, it's amazing from the beginning how quickly the work is done, how basically painless the work is. That's amazing. One thing that that's been proven to me is that science tries to alleviate a lot of things based on the symptom of dryness. Maybe there's new mouthwash for dry mouth or whatnot, but the cause of it is simply the tight muscles, which once relieved by the balancing of the teeth, allows everything to flow again. How simple is that? It makes a big difference structurally. I don't feel like my teeth are going to fly off anymore if I'm, chewing and bites on a bagel. Psychologically, emotionally, and again, as much as they cost, if I lose my job, I'm going to be able to go right back out and with much more confidence be able to talk and present myself before somebody.